Leah, can you hear me? Can you? Can anyone hear me?
I can hear you. Can you hear me?
Hey, Cedric, I can hear as well.
Oh, hey, Cedric.
Hey, Lee.
Yes, I can't hear you.
Oh, okay.
Okay, now I can hear you. Make sure your microphones are on.
Oh, shoot. Mine is probably off. Let's be real.
Okay. Cedric, okay. Awesome. Now we need, no, I can hear you now. Now. Now we're waiting on Fran and Dr. Benjamin. So weird. I'm sorry, we're like experiencing a little bit of technical difficulties. Here.
I'm just impressed by this whole system, this period. You guys are kicking butt.
Yeah. Um, here, on the but I can't see um,
What?
It's getting better. It's getting better. Except look at all this stuff. I'm like, oh god, I need to turn my camera. It's embarrassing.
from DC.
Oh, fabulous. Hello from Atlanta.
Awesome.
Yeah.
Hello from Tampa.
And Florida.
Oh.
That's right.
Finally got this thing to work.
I know. I'm so impressed. Just this whole setup is way over my tech skills. So I'm just happy I'm not the one messing it up.
Clearly, I had the same issue.
Yeah. I don't know how to work this.
Too much. Okay. Dr. Benjamin, like what helped me, like if you're on the line, what helped me was coming out and then going back in. So you might want to try that. Hey, you're in, Dr. B. But I can't, like, oh, you need to click the mic.
Can you hear me now?
Yep.
Yeah.
Success.
Okay. Do we have everyone?
I don't know whether we have Pascal.
Yeah.
Be right back. Hey, Pascal. Oops, sorry about that. Okay. Yeah. Okay. Yeah. So did you want me to start it off? Or can you do? Oh, yeah. Okay, let me put you on speaker. Okay, give me a minute. Okay, technology here. So I have Pascal on the line. So Pascal, did you want to start this off?
Yes, we should go ahead and begin. Thank you all for being on the call. I do apologize. I am experiencing some technical difficulties on my end where you aren't able to see or hear me. But does this work fine? Can you hear and see me? Or just hear me from the phone speaker?
Yes, I can hear you.
Yeah. Okay, awesome. So we'll go ahead and begin. So first off, good afternoon and welcome to APHA's Public Health Education and Health Promotion Section Student Work Group Leveraging APHA Membership for Public Health Leadership Facebook Live webinar. I am Pascal Edouard, a marketing co-chair of our section Student Work Group. During the webinar, you will learn how to make APHA work for you in your leadership and public health professional development. Joining us today are Dr. Georges Benjamin, Francis Atkinson, and two panelists who have reaped the benefits of APHA membership. So without further ado, we'll jump right into our webinar, beginning with Dr. Benjamin. Thank you, Dr. Benjamin, for taking the time this afternoon to be on our webinar. How are you this afternoon?
I'm just fine. And hello, everyone. Let me also just thank you all for joining us today and really being a part of the American Public Health Association. You know, many years ago, the Institute of Medicine looked at core functions of public health and defined what we call the 10 essential services. And those core functions were assessment, policy development, and assurance. And they wrapped around 10 things that public health does, you know, ensuring access to care, mobilizing communities, doing a lot of engagement of communities, a whole range of things that we do in public health. And what's, of course, important is that they require well-trained people to do these various activities, as well as it requires the leadership skills necessary to, frankly, do those three core functions. And APHA provides both activities around leadership. We certainly are involved in the education and skills development business. We provide opportunities for networking and mentoring. And of course, through programming, individual and collective action around advocacy. But let me try to take each one of those three core functions apart and talk a little bit about what APHA does in terms of trying to help you as you grow in your careers do that. So the whole issue of assessment and being science-driven and evidence-based is not something that is an inherent skill. It does require training, understanding. No question that you get some of that in your training when you're going for both your masterate or your doctorate degrees. And also those of you who are in the undergraduate level, you certainly get some of that as part of your undergraduate training. But like everything else in the world, it's not real world training. It's the book stuff that you get when you read it in a book or you talk to people about it. And what public health does, particularly through the American Public Health Association, we try to give you real world skills by some of the things that happen at the annual meeting, in particular, to try to help people better understand the evidence base and science of public health. Also, the same thing around policy development. You know, APHA has both an internal staff-driven policy process, as well as an external member-driven policy process. We have over 1,000 policies in our database. And so APHA affords you the opportunity to take ideas that very well may be abstract to you. You want to solve a problem and work with others to actually build and write policies and drive them to a policy process to come to consensus. As you know, we're a democracy as a nation, and democracy sometimes is pretty messy, and policy development in itself is pretty messy. So within the association, you learn to take very abstract ideas, make them concrete, and at the other end of our policy process, actually put them in policies that the association can use. And then we help you through the policy development process to actually make those things happen through the assurance, through our advocacy efforts, through grabbing and getting you involved both through your affiliates, through your sections, when you come to Washington, and we ask you to advocate for things, or we give you the tools for you to do that advocacy back at home to really make a difference. It's very clear that public health in its very core is about policy development and changing systems, in addition to the individual care that you can provide if you're a clinician or you're providing services to individual people. I think that, if you think about the really neat things that the association does, you can write book chapters, you can write books. We have a small publishing company which affords our members the opportunity to be involved in actually contributing to the literature of science, public health, science, medicine, health. We have student members that are on all of our boards and commissions, members that are on our publications board, student members on the American Journal of Public Health board. Right now, we have a really exciting project that was initiated by the new editor. Actually, it's not so new anymore, but Dr. Moravia has a student-led group that's looking at issues that are pertinent to students and providing really new and interesting ideas on how to take the American Journal of Public Health, which is really the gold standard in public health journals, and using the journal to develop skills and better educate people. And we've got a student think tank that's working, and you can be part of those kinds of things as part of the association. Just writing articles for the journal. Obviously it goes through peer review, but it's a rigorous process. And so there's an opportunity for you as a member of the public health field, certainly as an APHA member and as a student, to be part of writing articles and submitting those articles to the journal. Now, it's true, you don't have to be a member of APHA to submit articles to the journal, but having mentors that can help you and people that can help you both think through the research that you're doing, thinking through how you write those papers, is something that APHA certainly affords you an opportunity to do. I think, frankly, at the end of the day, I've had a lot of different administrative and professional experiences, and I got to tell you, the experiences that I've most benefited from was my relationships with others, particularly through organized societies. American Public Health Association is an organized society. The opportunities for networking, mentoring, rubbing elbows with some of the people that are the giants in the field is so very, very important. That I don't think, you can't measure the value of engaging in people in the public health field through our many venues. And then finally, leadership. Leadership development is very important, and the association offers you various opportunities to enhance and develop your leadership skills, from working within the student assembly, working within your sections, becoming part of the leadership of the assembly or a section. SPIGS is another opportunity for you to develop leadership. Being a program planner, opportunity to learn to put together scientific programs of high quality. Developing your leadership skills through the trainings that we offer at the annual meeting. through the advocacy sessions that we do at the annual meeting. All of these things help build your skills. I always tell people that the most important thing they can do in public health to advance their career is become very, very good at something, at your area of expertise, the area that you want to develop as your area of expertise, and then engaging with other people who also have that area of expertise and trading stories, learning from each other. Because that's what public health is about. It's about a collective learning opportunity for all of us. So with that, let me stop and let me turn it over. I think, Fran, you're the next speaker, and I know we're going to have some Q&A at the end.
Right. I'm sorry. I think I'm getting feedback since I have Pascal on the line. I'm going to, Pascal, I'll call you back after I present. Is that okay? Okay. Oh, okay.
I'm going to go ahead and mute my phone, and you should be able, there shouldn't be any feedback.
Okay. Okay, great. So what I'm going to do is I'm going to quickly go through a slide presentation to give you a better sense as to what the member benefits are of becoming an APHA member. So just bear with me right now. Okay, so hopefully you can see my screen. Can someone confirm that for me?
I can see it.
Okay, great. Okay, fantastic. As Dr. Benjamin was saying, one of the best things about APHA is that we are a community. We are the public health home. I always welcome folks home when we go to the annual meeting. And we have a company over 145 years within the field of public health, as well as we disseminate research, as Dr. Benjamin mentioned, and we do provide professional development and networking opportunities. And I'm going to go through that as we move along. So, I'm going to just jump ahead and tell you a little bit about some of the benefits of being a member of our sections, as well as our special primary interest groups, the forums, and the caucuses, as well as the student assembly. So within APHA, you can see on your screen that we have quite a number of different member groups, as well as when you become an APHA member, you automatically get 2 sections. And these are the sections. So sections are groups that are in the field of, if there's a field of public health or a profession. So as you can see, we have public health nursing, we have public health social work, as well as HIV/AIDS. So there's many, many opportunities to get involved. And what I always say is that the sections are the foundation of APHA, as well as we wouldn't be able to do the work that we do without our volunteers. So many people know our little secret is, many people don't know that our little secret is we only have 75 staff members, but we have 750 volunteers. So they really are the folks that help us move APHA along. They are the individuals that help us do advocacy. They're the ones that Dr. Benjamin mentioned, our program planners. Well, we wouldn't be able to have an annual meeting without them. So again, many, many opportunities. We also have special primary interest groups, as you can see, pharmacy and veterinary public health. And then we have forums. Forums are groups that cut across the sections. So I'll use breastfeeding as an example, where you will find the maternal, child, and health section, food and nutrition, international health sections coming together to discuss this topic. And then we have the caucuses. So the caucuses are affiliated with APHA, but they are not part of APHA, but it's a great place to learn what's going on, say, for instance, in terms of based on commonalities, whether that's like being a part of the Black Caucus of Health Workers or the Latino Caucus, or social issues such as homelessness or peace. So you see that like we have many options here. But like what I really want to get into, because I understand that many of you are either students or early career professionals, is talking about the Student Assembly. They, as you can see, creating a new generation of public health professionals. And I have to tell you that out of the 60 groups that like I manage, the Student Assembly is by far the front runner. They do so much, and you'll see in a minute what I mean. So like the Student Assembly is the student organization of APHA. And like for every student that joins APHA, they automatically become a member of the Student Assembly. It's the largest student-led public health organization. And I don't want to say nation, I want to say world. The largest student-led public health organization in the world. As well as the forum of students are able to share information, develop leadership skills, improve public health knowledge, and network with professionals. So the mission of the Student Assembly is, like, as you can read on your screen, improve the future of public health by promoting excellence and professional development for students in public health and related disciplines. So hopefully this is appealing to you. And they do have a membership of over 6,000 represented across the world. And what I want to emphasize is that it's made up of many different degree programs. So say, for instance, if you were going into nursing, we still accept you. You don't have to be focused on public health. Of course, you just need to have an interest in public health. And I want to show this to you because I think what the biggest thing or interest for you is how can you network and how can you have more professional development. And there are many opportunities within the Student Assembly. There's over 15 different committees, as you can see. Two of the most popular ones is the Campus Liaison program, where the Campus Liaison represents APHA and does a couple of activities. Normally, like one of those activities would be during National Public Health Week, as well as we have the section liaison. So every section has a student liaison, and it's a perfect way to learn and meet people in the field that you're in. And what they do is take you under their wing and show you how to get more involved in the section. And that's the very start of moving through going up the rung of leadership. So what if you became a student, what benefits do you get? Well, for one, as mentioned before, there's a lot of leadership positions. I've already mentioned the campus liaison and the section liaison positions, but another one, if you can't do a lot of work because you're so busy with school, we do have membership ambassadors, and they are the individuals that welcome new students to APHA and provide information as to how they can get involved. As far as awards and grants, so we have the Action Grant, and that's around advocacy as far as helping a student to organize an advocacy campaign. So we give them a grant, as well as they do have awards as far as the chair citation and outstanding student abstract. And like one of the biggest perks, I think the students do a fantastic job with the annual meeting, is that on the Saturday, they normally have a national student meeting in which it goes the entire day, and it's normally focused or driven on professional development. Also, there's an opportunity during the lunch where we have leaders dine with the students and talk about, like, so that they can talk about their careers. The Student Assembly also creates scientific sessions. So I'd like to, if you haven't, like as far as maybe next year, sending your site, like writing up an abstract and sending it to the Student Assembly. We also have scholarships. We have 50 scholarships, and normally that covers about $500, and that goes towards your travel to the annual meeting. So normally we post that as far as the announcement in towards the end of June. So like look out for that. In addition, at the annual meeting, sorry, I'm going over. Okay, like with the annual meeting, we have like a speed mentoring event that they do, as well as sections do roundtables for students. So I just wanted to highlight that. So I'm going to go fast. Like these are some of the other perks. And I also wanted to talk about like that we do have a program for those graduating students. And there are opportunities. So we have the early career professional, but like you can also join as a regular member. So say, for instance, if you're making less than $40,000, you can become a regular member. But I'd like to encourage you to consider the early career professional. It is a little more in cost, but you'll see that like there are so many great benefits. So like pretty much every month there's a webinar. So every other month we have webinars on professional development, as well as like, say for instance, work-life balance. And then the other months in between, we have a leadership institute. In addition, at the annual meeting, we have a half-day workshop, as well as we have individuals that will assist in doing a resume review. So there's quite a lot of opportunities within APHA if you're a student or a graduating student. So that's the end of my presentation. So I will turn off that. Okay, and you can see me again. Yay! So that's all I have to say.
Thank you so much, Fran.
No problem.
Next, we'll go ahead and move on to our two student panelists. We have Cedric Harville, who is a doctoral candidate at the University of Florida Department of Health, Education, and Behavior. Cedric has been a member of APHA since 2012 and actively involved since 2013 with the Public Health Education and Health Promotion section. He has served as a chair for the Student Engagement Work Group and co-chair for the Materials Contest within PHEHP for multiple years. Cedric's interest in public health stems from understanding how to approach health issues through the lens of prevention and education. In recent years, the use of technology has been a focus that Cedric has been interested in for addressing obesity and weight management health problems among minority men. Cedric's ultimate goal is to become a tenure-track faculty member at a major research institute to continue these studies. We also have Leah Scoop. I hope I'm saying your name right, Leah. And Leah is currently an ORISE Research Fellow at the Centers for Disease Control and Prevention in the Division of Adolescent and School Health. She is a recent graduate from Texas A&M University, Department of Health and Kinesiology with a PhD in Health education. Her research and programmatic focuses on school and community-based sexual health education programs for adolescents. Her experience working with schools and communities to design, implement, and evaluate sexual health and teen pregnancy prevention programs spans diverse adolescent populations and addresses disparities and inequities in sexual health educational programs and related services. Her commitment to public health education research, teaching, and service is evident through participation in APHA over the last several years. So the way we'll go ahead and do this is I'll pose a question, and Leah and Cedric, you both will provide responses to the questions that I pose, okay? So what role did you have or committees did you serve on as APHA student members?
Cedric, do you want to go first? You are quite the rock star.
Want to go first, Leah?
Oh, sure, yeah. So, like was read, I have been a student member of APHA for the last several years as I was finishing my doctoral work at Texas A&M University. And during that time, I had the pleasure of meeting Cedric and other student members and professional members in a couple of different sections. So I was involved with the public health education and promotion, also in the sexual and reproductive health section, and then also school health education and services. So as a kind of student member, I did not hold any leadership, but I benefited a lot from the relationships that were built in those different sections and in my participation at national conferences, monthly webinars, resources. I'm sure we'll talk more about that later, but that's kind of the sections that I have been plugged into in the last several years with APHA.
Awesome, thanks, Leah. What about Cedric?
Yeah, so similar to what Lee was talking about, with education, health promotion section. As you talked about, you know, most of my work had been as the chair and co-chair for facilitating with the materials contest, and also so work sex well as one of the section liaisons that Fran was talking about earlier, which engages all students across APHA, from allowing them to network, see how other sections are being successful, and are going to kind of piggybacking and finding the best ways to engage students. Did I answer your question all the way, Pascal?
Yes, you did. I also have a follow-up question, actually, for Leah. Leah, you're obviously, as I read, an ORISE research fellow. Would you say that as a result of your membership or participation in APHA, that provided, probably made you stand out when you applied for that fellowship?
Yeah, absolutely. I can speak a little to that. So my background, like Cedric and others have said, is actually in education and school-based teacher preparation. And so I don't have a traditional training in public health. But one of the things that I so appreciated Francis saying is that one of the benefits of the student assembly is, and participation in APHA then, is that it cross-cuts so many disciplines that have a focus on public health, health education, health promotion. And so as I was, coming up as a student through graduate work, I realized very quickly that there was a place for me at APHA with the breadth and depth of content and professionals that are part of the organization. So upon graduating, I now, like you have said, I am an ORISE fellow at the Centers for Disease Control and Prevention, the premier public health agency in the U.S. And so the connections that I started and continue to foster through my time at APHA have absolutely been beneficial as I've kind of transitioned now to the other side, into the working world, being here at CDC. So again, not traditionally from public health background, but I think the organization has provided me a very clear and very complementary path to getting to the place that I am right now.
I think to come behind what Lee was saying, APHA has been. I guess to come, APHA has been very beneficial to me as well. I went to the APHA my first time in 2012, and I was able to go to attend the APHA annual meeting, at math level institution, University of South Florida, where I received in 2013. And APHA was a wonderful experience for me because I was able to and work the booth and kind of look and see. APHA for me, and your first time is busy and kind of hectic, and there's so much going on, but it's a lot of positive interactions, be different, etc. And so that me going to APHA the first time and working the booth for USF, I was able to meet a professional, a faculty member who used to work at USF, and suggested, "Hey, let me see your CV. Should we have a program at the University of Florida?" And that turned out to be and fellowship as well. And so that was my first APHA. So I was like, I gotta stay involved because there are so many doors that. And so there are students who, want to change the world, students that want to do something very positive. Especially in our section. I'm a little biased because I've been a part of PHEHP, but great professionals, other students that are in the professional field like you, Lee, friend rating EDC as well, who got me involved in education. I'm a student assembly chair and so on, and countless other leadership positions. So, and you're going to be in different leadership positions. That's just kind of how it seems like it is.
And I just want to jump in because, as I mentioned, that there are so many opportunities. So, you come in and you're working at a booth, and as you move along, as Dr. Benjamin mentioned, you can be on a variety of different committees. So, right now, you'll see our executive board members, where we have several individuals that came out of the student assembly that are official executive board members, as well as we also have a seat for the student assembly chair that participates on the executive board, and they are a voting member also. So the organization really takes our students very seriously and working towards leadership and professional development.
Thank you. One of the questions that we wanted to ask, more so directed towards both Leah and Cedric, is did you all form any mentorship relationships during your time with APHA, or do you have you served as mentees, if you will, during your time or participation in APHA?
Sure, I've gained quite a few mentors over the years who I keep in regular contact with, especially people, professionals that are in the field that have the same research interests that I think it's very, especially if I'm speaking on the academic side. Since faculty members that are doing research in the area that have interest, people that papers that I've read, who are in the area that I'm looking into. It's very easy to see those people and go to their posters or presentations and talk to them about their work, and kind of build that relationship, and ask for guidance and mentorship. Very easy, great job of, I don't know if it's just the people in general, but it's very easy to reach out and, talk to those people that might be, the heavy hitters in the field or area.
Do you want to add on to that?
Sure. Sorry, I was just breaking up a little, but I agree with everything Cedric said. I think that the student assembly at APHA and just the organization in general is so student-centered that it kind of breaks down these barriers and fears that students might have about approaching, faculty members or talking to these famous public health people that come for these annual conferences and meetings. And so I know myself, I've benefited in many different ways in terms of just getting connected with professionals in the field, swapping business cards, even if it's
We lost Leah.
I think we lost.
So we lost Leah.
Well, I expect she'll come back. Let me just add the fact that one should not be intimidated by the VIPs that are at our meeting, and they are all over the place. But I remind you, they put their pants on and their dresses on just like we do. And, they want to work with you. They want to be part of engaging you. So they're there to help you. Otherwise, they wouldn't be there at the meeting. Hi, Leah, you're back. Can't hear you yet, but can we?
What happened?
Are we back? Are we live? Can you hear me? Oh, okay.
I can hear you, yes.
So.
Do you want to continue, Leah? Can you hear Leah?
I see Leah. I haven't heard from Leah.
Do we have another question?
Oh, good.
Okay. Were you finished, Leah? Because I think you cut off. Okay, I can't hear. I guess for the sake of time, we'll move on to the next question, specifically called 48. So I guess more so directed to you, Cedric, is granted, APHA is beneficial in gaining in working with individuals who are, I guess what you would say, are gurus in their field, and building those networking and mentorship relationships. For some of us, networking with public health gurus, well-established in the field can be a little bit intimidating. So what advice can you offer students who may feel intimidated, if you will, with approaching some of what I like to call public health gods or gurus?
I think the biggest thing is, you have to be willing to take not necessarily take a risk, but and if there's something that you want or something that you're seeking, some information that you want, you just have the confidence to it can be to strike up conversations with some of these professionals who have been in the field for 20 plus years or who are superstars and but they were once students just like us, and the way that reach a goal that you're trying to attain, and things like the positive response or positive feedback in return. And so, confident, being willing to step out of your comfort zone, to ask for whether job opportunity or something like that. And so, if you're in a meeting, if there are professionals that you want to meet and they have research for you, use that as an easy way to strike up a conversation. Ask questions, You can do those type of things. As in the program, so you can know what professionals are going to be presenting, tech information, things of that nature. So yourself and understanding that what's the word to say is and most I'll say you would most likely never get a no. So maybe someone say, let me direct you to another person who might be able to help you out better, get you in the right direction.
And if I could add on that, to be prepared, you're about to go to a public health event. Think about the 2 or 3 things you absolutely want to know from anyone who, in case you happen to meet somebody that can help you with those answers, so that your questions are thoughtful, succinct, and engaging. And if you thought about it up front, then you're less likely to get to them and be awed and babble when you have the opportunity to meet somebody. But if you thought about what you really want to know, then I think you can take that advice you just heard and use it most effectively.
Yeah, I would add also, I mean, echoing everything that both Dr. Benjamin and Cedric have said, I think someone told me once that the opposite of networking is not working. And so that was always something that I took with me. And in my responsibility to network at conferences was doing my homework, like Dr. Benjamin just commented, and doing a little bit of research and figuring out who's going to be there or what kind of questions do I have and who do I need to connect with strategically to try to get those questions answered. And I never felt intimidated or less than, or, oh, I'm just a student. All of the professionals that attend APHA, and I think that's just a characteristic of public health in general, but are all very serving. And I found it to be really easy to confidently go up and introduce myself and tell people this is what I'm interested in or this is what I have questions about. But you do kind of have to step out of your comfort zone a little and be confident that your questions, your passions, and your interests are really going to be hopefully answered, or you're going to be connected to people that can help you answer those questions through participation in APHA. So I agree.
Christelle?
Yes, thank you. Yeah, we'll just go ahead and do. Are there any last nuggets of wisdom that either one of you would like to provide for us before we go ahead and move on to look at any questions some of our audience members may have?
Ooh, nuggets of wisdom. I would say just get involved. I mean, right? As a public health professional in training, if you're a student or even if you're a young professional, emerging professional, I mean, we have a responsibility to be engaged in the profession. And that's in research and teaching and service and participation. And so taking that responsibility seriously and getting involved and engaged, and I think APHA is a prime outlet to do that. So really carrying the charge and being engaged and motivated from the very, very beginning in any way that you can, in all ways that you're able.
I would just co-sign everything. Get involved, participate as much as you can. And, if you know where to start, just start with the student assembly.
Yeah.
Individual set interest most why, see what they're doing as students, and things of that nature. But, and also if going to the conferences can be, but as that you attend APHA, it's worth the cost of attendance, the benefits of that. And so, generally your school, ways to kind of mitigate those costs. And also, during the summer, the student assembly has scholarships. It's up to $500. I've won that twice to help mitigate some of the costs for me. Be sure to look out for that announcement in June or July when that comes out. because as a student, take advantage of to attend the opportunities to attend because it can be invaluable.
And it's really fun. Which is also why you should participate.
Christelle, back to you.
Okay. Well, thank you all for taking the time out today for being on our Facebook Live webinar. I'm not seeing any questions on the feed. I'm seeing a lot of comments, though. Good comments. However, I do want to thank you, Dr. Benjamin, Fran, Dr. and Lee, for really taking the time out this afternoon and being with our students and letting them know about the benefits of these things.
And I recall that you had a question when we were talking offline, as far as a lot of students do feel that sometimes it's expensive to join APHA, but there are other ways. As far as the membership cost is $85, but I always encourage students to use the green discount. So therefore, you wouldn't be getting the paper journal, but everything else is online, and you will be paying about $65 instead. So definitely consider that option.
Thank you, Fran. And remember that this is an investment in your future. You're in this business. This is a collective business. You're in here for the long haul. So make an investment. Invest in being a member of APHA, not just with your money, but also invest it with your time. We love to have your money. There's no doubt about that. It helps pay for the resources that you see that we can give you. But I got to tell you, the most valuable thing that you have is your engagement. So I encourage you to actively engage in the student assembly, in your local affiliate, in your section, and take advantage of all this, because pound for pound, this investment is well worth the time that you put into it.
Also, one of the things that I do mention to students is that if you can't find the $65 to be a member of APHA, consider being a member of your state affiliate, because quite often it is a little less expensive. And this way you can interact on a local basis with public health professionals. So that is an option as far as if you just don't have the funding at the moment to become an APHA member. Consider becoming a member of your public health state affiliate.
And Fran, this question is for you too. Are you aware of if there are any schools or colleges in public health that do provide scholarships or pay for APHA membership?
Actually, there are a couple. We have a student, what I call a student bulk program, where the school will pay for their public health students to be members. Dr. B, can you give some examples? One being Yale.
Yeah, CUNY is an excellent example. City University of New York has made this investment in their students. Yale has made this investment in their students. I think a couple of the Georgia schools have made investments in their students, where they're providing the resources to be part of the membership. And some, of course, as you heard from our two students on the call here, that there are support from many of the schools for their students to come to the annual meeting. So I just encourage you to check with your school, see what they're doing. But be engaged, be a part of this. See, at your affiliate level, at the national level, again, it's a best buy. And thank you, everyone. I appreciate your time this afternoon. And Pasquale, thank you very much for hosting us today.
Yeah, thank you.
Oh, you're welcome. Thank you for taking the time out again to be with us this afternoon and for sharing all your wisdom. So with everyone on Facebook Live, I do encourage you all to consider becoming APHA members. It's been a great experience so far for me, and so has it been for Cedric and Leah. So we all encourage you to become members. Thank you.
Thank you.
Thank you.
Bye-bye.
Ciao.
You're welcome. Bye. Bye. Have a wonderful afternoon.
Okay, so I logged off.